Hello, my name is Silke Mader. I'm the chairwoman and co-founder of the European Foundation for the Care of Newborn Infants, and it's a great pleasure to introduce you today my topic, how to support parents in the NICU, a parent perspective. The overview I want to give you today is giving some examples of my personal story, but also why family-centered developmental care is so important in the NICU, and when parents cannot be with their baby in the NICU, which kind of opportunities you would have to support parents in this really critical situation. How can we as parent organizations and you as healthcare professionals together to improve the care in the NICUs in the future? And also some personal thoughts in the end of this presentation that we all should never give up, and it really matters what you are doing every day in the NICU. The reason why I'm doing this work today is that I had myself 22 years ago a preterm birth. I delivered in week 25 two very tiny babies, Lucas with 515 grams and Lena with 290 grams, and I was myself resuscitated. I had a very severe form of HELLP syndrome, and it was not clear for my husband if one of us really would survive, and if yes, how. And a real challenge at this time, I'm giving birth in Germany, here in Munich, in normally a very rich and good setting. In the end, I was not informed at all about this issue, prematurity, or I had this preeclampsia. So we as parents at this time had no Google and no opportunity to inform ourselves. So we were really dependent on the information we got at this time. And so we were overwhelmed with not knowing what happens with our children. My husband and I, we are both preschool teachers, so we had in our professional life a lot of very severe disabled children who were born preterm, and so of course we were very, very scared that we will have in the future two very severe disabled children ourselves. And so lacking with all this information and support, we somehow survived in this NICU environment, and the picture you see here, it is in German mentioned, the first kangarooing was a month later as our children were born. Our Lena died already after a week, and our Lucas, what you see here, kangarooing with me, and I'm sitting on the only chair at this time in this new NICU really exists. And I was scared that also my son will die as my daughter Lena, because at this time we had no psychological support and we were overwhelmed with the situation of having no information, being alone with everything and feeling somehow as a parent, but not really were or felt like parents because we were just visitors at this time in the NICU. And we had as parents really not any kind of support, no information, no support for breastfeeding. We had the opportunity for 3 hours to visit our son Lucas, and here you see also a picture of my husband Oliver, and this is why I'm stressing this really a lot in this talk, that you think about having not only support for us as mothers, so thinking also about the fathers and the other family members like siblings or grandparents who should have the opportunity to see their new family member and really involving them in their everyday care. Why is this so important? Why is family-centered developmental care such an important issue, not only for us parents, but also for the child themselves later in life? And what we have as parents in the very beginning is that we, of course, never thought about being a family in a NICU. So everybody says, well, you're pregnant, everything will go well, hopefully the child is healthy, and all this kind of phrases many of you for sure know. And then you think not at all that your baby will be born preterm or will have lifelong conditions to suffer the rest of their life. So you wake up from one day after the other in this nightmare situation. This is the first room of the child, the first time you see your baby in a very intensive care unit setting, that we are not familiar with all this technique. We have not the opportunity to touch our baby. The baby itself, it looks and I'm allowed to say this because I'm a mom of such a tiny baby, they look ugly. They are fetuses, so the body looks not like a normal born baby. And so you are overwhelmed with this kind of emotions. On the next second, you feel guilty because you thought that maybe your child is not beautiful or your child will be disabled. And so you are in a kind of roller coaster all this time, and you cannot really talk to someone. Also between a couple, it's struggling really to cope with these feelings and be powerful enough to go every day in the NICU and see your tiny baby, and being full with emotions of hopefully everything will go well, but you don't know. And that's something where these parents, when they are in your NICU, have to handle the situation really every day. And coping with the situation really means many, many things. So how you talk to the parents and how you explain things to them and how they can follow all these different messages they got during this NICU stay. And what we know all from the evidence is that the experiences during the pregnancy in the NICU, but also after discharge, really matters to the outcome of these tiny children. And so it's so important to think really carefully about talking to the parents, how to support them, what you can offer them, that the parents and at the end, of course, also the child feels somehow at home in the NICU because it's their first room there. And we know, and we cannot really change everything in a NICU, but we know that during the pregnancy, it is silent. The smell of the mother is there. It is different kind of positive simulations you have. The odor of the mother's smell is around. So everything looks perfect. And from one day after the other, this baby is born in this intensive care unit. And of course, you do all the best to take care of this child. But nevertheless, there are situations, they are painful. It is very light in such a NICU. There are negative stimulations. The smell is different. It smells not like the mother smells. It smells like a disinfection spray or whatever. So the situation is really different. And in this environment, this baby develops, and we know that the brain, the lung, and all the other organs develop in a different way, and it matters how we treat the baby, how noisy it is, how light it is, how positive we can associate the situation with the parents and the NICU colleagues. What parents really want and what their wishes are is to be close with their child. It is, of course, obvious that they want to have this, but in the daily care in a NICU, it's challenging to really welcome the parents all the time. And often, many NICUs have not the resources or not the facilities to welcome parents 24/7. But this is what parents, of course, want. They want to participate and have influence in the daily treatment and care. They want to feel safe, and of course they would like to have qualified staff, that they are well organized, and that they have an open communication, because you as nurses and doctors are taking care of our children, and so therefore we have to trust you. And how much more you open your heart and your doors from your NICU, the more we can trust you and can let our babies in your hands. What we as an organization have recognized that in the different countries in Europe, but also around the globe, there are huge inequalities in the care and the support in the NICUs. And you see here some different pictures. The first one you see in East European countries where parents are often not allowed to be with their child at all, or they come once a week for half an hour or an hour and can see their baby. We are not talking about kangaroo care or touching the baby. It's really a challenge for them to see their baby suffering, and also the staff have challenges to cope with the situation. They can also not change their world in one day. And so the other two pictures on the bottom you see are two pictures from Germany, where you see also in my own country we have very different situations. In one where parents are welcome but only have a chair to kangaroo and visit their baby. On the other side you see a whole family where the father is kangarooing and sleeping together with his child, and the mother is taking care of both and also have the opportunity for some rest. And this difference is for parents and our parent organization challenging to accept that such inequalities happen around the world. And why happens this? And what can we change really to offer the parents 24/7 in a more home setting environment? Parents are parents, and parents are no visitors. And it's very important to stop signs like stop, ring first. So you want to see your baby. So how can you offer an opportunity to welcome them really 24/7? Which kind of regulations you could change in the next couple of weeks, months, and years to welcome parents as a part of your team? And this is something what, of course, needs many, many discussions in administration, in hospital staff, team structures. It really needs a common decision and a first step forward. So this is something what is really important to change to welcome parents wherever they can come and see and hug their baby. Welcoming the parents need also to think and reflect your own NICU entrance. How can you change it to a more welcoming entrance area? You see one picture where there are a lot of signs and it looks like in a hospital, and then you see the other picture where it's mainly colors, so it's not so much renovation necessary. So you see a yellow and a blue colors. You see two leather seats where parents can wait and maybe can have a discussion outside. So it's really a question of willingness to change the design and the welcoming of parents in a NICU. And welcoming means not only putting some words in the welcome area, so it means what you see in the other picture where the nurse and the mother is weighing their baby, and you really can feel the relationship these two have. And so they weigh it together. They have, I guess, also a little bit fun, and so they have a relationship, a warm relationship, because both of them are taking care of this tiny little baby. And for me, living here in Europe with all these different cultures, it's for me very important to share with you also this picture and to show you how important it is to make no difference between these different moms and dads. Their parents are all the same and want that they be with their baby. And when you see these pictures, if you have a different skin color, a different religious background, or a different gender, all of these parents want to touch and hug and love their baby. And so how can you think about being a welcoming nurse, a welcoming doctor, to ensure that all these parents feel warm, welcomed, to offer language translation, to think about different cultures in your unit? How can you ensure that these parents can be parents in a NICU? I was a long time, 4.5 months in the NICU, and I add all this 4.5 months, and I'm sometimes joking with some nurses and doctors, and I said, I cannot eat any longer sandwiches because I was 4.5 months in the hospital and I eat sausage and cheese sandwiches for 4.5 months. And this was really a challenge because you cannot eat everyday sandwiches. And when you not offer the parents really healthy food and something warm at around lunchtime or dinner time, how can they survive really in this setting without having access to really good food and something to drink? How can you maybe arrange an area where parents can make their own food, or you have give them access for a cafeteria where they can eat and drink and also have some rest? You see here TV in the end of the of this room, where they also have somehow a normal life. And this is for me very important, because I had this situation and I really lost my whole milk, and I really lived 4.5 months without really a healthy lifestyle, and that is a big burden for many of these parents. And so therefore, how can you internally discuss what can you offer the parents? A room, access to the catering area, that parents really can survive in this time frame of being in the NICU. We struggle a lot in the last couple of years to understand why parents need not only a chair, why parents need a bed and feel welcomed and really have the opportunity to lie and have some rest. And when you see here the baby, it's breastfeeding, how can you ensure that this breastfeeding really works well? You need an adult bed for the mother, and you need also some rest when you are every day in the NICU. When you rebuild a hospital, think about this. How can you offer and include such a system and such an idea of a real family-centered developmental care system in your NICU, and what can be done to ensure such a new rebuilding idea? That's something what can be seen in many settings around Europe and around the globe in the meanwhile. And so ask for support, and ask this hospital who have already realized such wonderful NICUs, how can this be possible in my own NICU? Parents, and especially in breastfeeding, you need support from a very good qualified nurse. And we are fighting for having more and better educated nurses and doctors, regular education and training like we see here in this wonderful e-learning system from NATIS. How can we offer support and education for, of course, the healthcare professionals, but also for parents to have this wonderful experience. As this mother, I was able to attend this situation where we made these pictures the first time that the mother had the opportunity to breastfeed her baby herself. Time is running, and after a couple of weeks and months, you are happy to go home. But you have to be prepared for this very special moment. And if you want to have a good life for this baby, you have to ensure that the parents are good prepared, are self-confident, and feel or be able to really take care of this child at home without this NICU and intensive care setting. That's something which start already at birth, so to involve the parents in the care and really ensure that till this time is coming to go home, the parents are really prepared, and they are informed and have a good network at home who helps them. So we say that discharge management really starts at birth, and this needs a plan, and this needs support, and I'm sure many of you have already such a discharge management system, but check if you have it and ensure that you implement such a discharge management system to let this baby and the parents go home and feel home and hopefully not come back in a hospital setting. But often it happens that parents cannot be with their baby in the NICU. That has, of course, many different reasons. It can be that the parent is ill, they have to travel, they have sibling at home, or whatever. So what we have done is to ensure that all these informations are going to the parents, but also to the healthcare professionals. We offer a lot of information on our website on EFCNI.org, but also we have developed a nice fact sheet with a couple of information you also can provide to your parents in welcoming the family in the neonatal intensive care unit. It's available in different languages and helps you to provide really nice information for the parents, but also for yourself to get more information what maybe parents want and need, and also the different aspects of not only the mother, but also the father's family and friend members and siblings. Sometimes it is not possible at all to come and see your family member. For example, in a global world where we are traveling around and living in around another world, grandparents can, for example, not see their baby or their grandchild when they are on the other side of the world. When fathers, after a couple of days and sometimes weeks, have to start again their work shift and travel around the world, that's something where they would love to see their child and have not the opportunity. When someone of the family members becomes sick, how can this happen that the parents can see their baby? So there are many challenges where parents face during this time in the NICU, and therefore we believe and we really push this forward to offer a digital opportunity to see the baby in the NICU. Of course, it's not replacing in the end a real visit and touching of this baby and speak with the baby, but it is an opportunity for having a little bit more a normal life when you are in the NICU. You are 4.5 months, sometimes longer in a NICU, and you cannot stay often 24/7 all the time, especially not when you have no facilities to keep these parents with their baby in a NICU. What we have done here in Europe is to recognize this problem first of all and discuss it with healthcare professionals. How can we ensure that the argumentation against the camera system goes more up in an opportunity for parents to help them to see their baby, to feel as a normal family member. We have done a collaboration with many healthcare professionals here in the German-speaking area, and we have developed a position paper in the argumentation of how can this help in the NICU, and also how can this help parents to ensure that all the fears they have sometimes for in establishing such a project in their NICU to get a better argumentation for such a system. So we have done this together with healthcare professionals. Many healthcare societies have supported us, and we are very happy that we now have this position paper available not only in English, but also in Hungarian, in German, in Spanish, and very soon will come a French version. But what are really the challenges for parents if you establish such a system in your NICU? Some of the parents have concerns what happens with the data of their child when this is a real live streaming. Do they record this data? What happens with the data? Some parents are also concerned about watching the baby during painful procedures, or when the baby is crying and I'm far away and cannot touch it and cannot help the baby. And this is something what can be for parents, of course, a challenging situation. And what they also have concerns is about equipment, radiation emissions. That's something what some parents have reported us could be a concern. The requirements for parents is, of course, that when you are not present in the NICU for whatever reasons, as mentioned before, you have the opportunity to see the baby. Of course, it's not a replacement. It's an additional supplement for implementing family-centered care. But this information for the parents must be clearly communicated, and the system should be, of course, user-friendly. Support during this time when something technically is not working should be provided, that parents really can get support during this time frame when they have a question. And it's important for them that every normal standard operating system, computer, tablets or smartphones are really able to be used for this technique. Important is that parents and the family members, whoever uses this system, are informed that such situations like a painful procedure or the baby is crying can happen. And they also should get information to to be informed how to act in such a situation when a baby is crying. And this is on the other side, of course, the fear from nurses and doctors that they get more calls on it. But the results shows very well that for parents it's very helpful when they have the information that this kind of things can happen and how they should react would be helpful for them to see in the end the system as very beneficial. Important is that parents are informed, and when the camera system is switched off, that something happened with the baby. It can be a bathing, it can be changing the diaper, it could be a medical treatment. All this information about such situations have to be, before such a camera system is installed, shared with the parents so that they know when the camera is switched off that something happened, and this could be A, B, or C. Important is that the light sensor ensures that the child, of course, has not a bright light in the NICU. So there are systems available where you only need a very, very sensitive light to see the baby. And, of course, hygiene standards should be ensured when such a system is installed. We had, of course, many critical questions from healthcare professionals about such a system, why we think it is important and why we not put more pressure on family-centered care really happen in attending the presence of these parents in the NICU. But in real life, we all know that the majority of the NICU still have and will have in the next couple of years not a perfect NICU with 24/7 and single family rooms or double family rooms. So what would be an alternative to offer parents an opportunity to see their baby, to feel normal when you go to bed, have one look on your baby? So many of these nurses told us that they would be maybe scared about being observed. But the ones who have installed it, they told us that it is a benefit for them. They have a much more closer relationship to their parents. They are have a nice exchange in the meanwhile. Parents feel that they can trust the nurses and doctors when they have such a system. Of course, the worry is also the additional work, because some parents are calling extra because they see their baby crying, or the pacifier was fallen out and maybe the baby has this or that. But we know that most of the calls in the end come when really things happen. And this is something what, of course, nurses and other administration persons from a hospital have to discuss and to find a solution to see these worries honest, but also to find solution how can this be implemented to support the parents and the baby, but also in the end to support the nurses and the doctors in the NICU to install such a system. And of course, the nurses have sometimes are scared for legal consequences, but when there is a live streaming and not a record, it should be normally not really an issue. And the biggest feedback from some nurses was that they're worried that the parents will not come when they see the baby every day, so they don't want to come and touch the baby. That's something what also the research shows that does not happen. Parents come more often because they feel closer to their child and want to see their baby every day. The challenge for the hospital and for the healthcare professionals is to include in the end the whole team, to find as a common project, to integrate it into the clinical routine and see this as a common project and supportive for the parents and for the child. So important is also that the nurses and doctors can switch off the camera if there are critical situations, if there are painful procedures, so that they really feel not observed in such situations. It must be, as for parents as well, user-friendly, and all the nurses and doctors have to be trained if they work with such a camera system. For the hospital administration, it is a different question to implement such a system. Of course, it's a cost issue. You have to have the financial resources to implement such a system, but therefore it can be an opportunity to make fundraising for such a system, or to have separate fees, maybe for parents who want to have such a system. There are different solutions, but first of all, yes, there have to be funding to implement such a project in a NICU. It has to be clear that it is extra work. So all of these healthcare professionals, the human resources in this team, but also in the administration, needs to be calculated for this extra cost of human resources, but also cost financially. That's something what have to be transparent and needs to be discussed, how to coordinate and organize it. Of course, the implementation of the system has to be discussed with the IT team, with the IT department. It has to fit into the clinical software system, and this is something where a whole team has to discuss this and has to make it as their common project. The requirements are that all these different groups needs to be involved already in the first step of the planning process. So not only nurses and doctors have to agree on this. It must be the staff council, the hospital IT, the data protection, the hygiene experts, and also the management. And it makes sense really when this idea comes up to sit together and find the potential opportunities, also the challenges, but also the requirements to have in the end a good solution to implement this project in your hospital. The financing has to be, of course, as mentioned before, secured, and the data protection regulations have to be clarified also for not only for the patient and the parents, also for the workers, that means the nurses and the doctors, that everybody agrees that a live streaming can be possible. The legal protection for the hospital has to be ensured, because parents can, of course, film the streaming parallel, but this have to be discussed with all the parents who use it, that the staff is protected for any kind of legal issues afterwards. Yes, and what I would recommend also is to supervise and evaluate this project from the beginning, and if possible, of course, evaluate the benefit of this project for the parents and patients, but also for the hospital staff, to see how this project really makes an impact for your daily work. There are many more informations available in this position paper. You find them on our website. It's for free to download. And please see this as a kind of recommendation from our expert panel, and included is also a conclusion of this expert panel. They recommend the system, and they recommend also to welcome the parents 24/7, and it gives you a kind of guidance if you want to implement such a system, and also the argumentation, because it's important not seeing only the benefits, seeing also potential challenges and requirements, because if you see this really transparent, then you can go to your administration in the hospital and ensure that you finally be successful, and not only see the positive benefits, but see also the things what you have to do, and from financing to argumentation to get these things done, because it's a very important, what I think, and good project to help parents when they cannot be in the NICU, what happens, as we know all, every day. How can we work together so to improve in the end standards like a camera system or like family-centered care in your NICU? And what we have done as an organization, we are now 11 years old, and we have founded this organization to create a voice for babies, in the beginning European-wide and now worldwide. We are the first pan-European organization, and since January also global organization, to represent the interests of the baby's voice, but also of their families. And what was for us very important is not doing this only fighting alone. We really want to collaborate with the healthcare professionals like you, the scientists, the industry partners, other experts around the globe who are working also on this topic. And combining forces is for us very important. And you see here a picture of our last parent meeting, and we started 2008 with 12 organizations. In the meanwhile, we have more than 100 organizations, and at this meeting were 80 parent organizations attending our parent meeting. And we are very proud that we have more and more parents who are giving these children and their families a voice in their country. We also collaborate with several healthcare professional societies and organizations because we want to implement standards, and this is something where we need to combine forces with everybody who works in this topic. We are working together also on World Prematurity Day. Many of you maybe know that we are founder of this day on November 17, where we give these children a global voice and work together. It's very nice to see here how this looks like. In the middle is our poster with many of our collaborative partners for this day. We collaborate on with WHO, with the World Health Organization, and of course also with the March of Dimes in the US and many others. And therefore we send out one message working together, and we are happy that every year many of you join us and giving our children a voice. You see here some pictures what we have achieved so far. So all over the world, organizations and individuals illuminate different kind of buildings and landmarks, and this gives our children to see what parents can do. Is really a nice picture here. Many organizations and especially hospitals are joining every year, and here you see some pictures from the Arabic states, from Africa, from Russia and Canada, and another overview you see from Madrid and Rotterdam, and many hospitals are joining with small and bigger events to also show what they are doing. They do a great job every day to support our children, and you, of course, as well. Every day you are fighting for the life of our children. For us, it was important that raising awareness is one issue to get a voice for these children and get awareness. But what we wanted, as I had my own preterm birth, is to ensure that we have the best possible start in life what we can have. And we know that there is a huge inequality between the countries. And why should in one country a baby survive healthy, where in another country with the same week, with the same weight, the baby dies or has a severe disability? How can we ensure that our babies, wherever they are born in the world, get the same treatment and care? And our dream was make a difference between the things what we have done so far and what we can do, where the best evidence is. And the difference between the countries are really huge in the infrastructure of high-risk pregnancies, if it is follow-up, if it is NICU design, if it is family-centered care. And this is something what we recognized already early in our organization. And this is where we said, how can we make there a difference? We have developed 11 working groups where we have birth and transfer, we have medical care, care procedures, infant family-centered care, NICU design. It goes up from nutrition and ethical decisions to follow-up and continuum care, patient safety and hygiene practice, data, education and training, because all of these things matters to really make a difference in the daily care. The development process of these 96 standards are very compact in the end. So we worked 5 years in making the decision of the different standard topics. We developed a common template to realize such a huge project to make it understandable for everybody. We developed in the end then the standards, and this had then an own process of voting and agreement of in total 220 experts. So it was a long process, and finally we had a voting of our project chairs who had to vote on a yes or no of our standards, and we are very happy that all of the 96 standards got an agreement and were then finally launched in the European Parliament to be accepted from this community, and now in the next couple of years we have to implement them. We are very proud of the next two pictures because you can imagine as a parent organization it's very unique and it's unique worldwide that the parent organization has developed such a standard project. And 108 international and national societies have supported this project and have given their agreement, a really written agreement to support and agree on the standards. 50 parent organizations have also agreed and support us in the implementation process, and 7 industry partners have supported us in financing this project. Very famously, we could launch this project in the European Parliament. We had 2 events, one in the evening and one in the European Parliament itself, where we had support from different politicians to launch the standards on a very, very high level. And very special is that nowhere in the world have parents and patients really developed such a process. It is really patient-centered because patients were involved in every single step. Very challenging, but also very fun, from my point of view, fantastic is that 220 experts from really different disciplines and from more than 30 countries have worked together. So that's ideal, the European or global idea of working together, and that so many organizations have really supported this project in this way. We are very proud that the Lancet has recognized us twice in this project, and you see here the last one on the day of the launch last November. The Lancet have given us the honor for an own editorial where they strongly support this project and recommend to implement this project into daily practice, and this gives us the opportunity to push things forward, that our patient initiative is accepted from a very, very high level. Now it is really the next step in implementing, because we of course are proud for having such a publication, but what we want is that this standards will become really practice, and that this standards will be used in every single hospital. And so we have an own implementation strategy. In September, we launch an advocacy toolkit to get hands-on information how to implement them, how to act on a political level, on a scientific level, on a society level to implement the standards into their daily practice. We work on an auditing system, of course also an academy, because we need, like you, trained experts who implement the standards in their NICU, and we will train also our parents and parent organization to support the healthcare professional community in doing it. But it's important that you never give up in working with our babies. And also myself, I never have given up to fight. And the reason why is my little son, Lucas. We discharged ourselves when he was 4.5 months old, so it was 2 weeks after he originally would be born. So we went home and we thought that everything will be perfect. And I guess you know that this happens not really when you go home with such a tiny baby. So the problems came one after the other. So the good thing was that we are both preschool teachers and we could manage a lot of support at home. So Lucas had two preschool teachers and therefore a lot of therapy 24/7 more or less. Lucas developed on both sides on his hips close to a luxation. You see on the last picture where he was at home after a very severe surgery when he was 4 years old. It was at this time not clear if he would ever walk. They gave us a 50-50% chance if he would ever walk, and if he walked, not more than 200 meters, they told us. And so we were, you can imagine, overwhelmed with being anxious and scared what happens with our life. And they diagnosed that he will be hopefully very intelligent, but if he ever will work, that was not clear at this time. So we had to fight really for having him in a normal kindergarten. And you see here, it is a school bag, what he has here in hands with my husband, Oliver, where we also had to fight bringing him in a normal school. In Germany, we have a very selective school system. So if you're normal, you can go in a normal school. But if you have any kind of disability, then you have not really a good, or at this time was not a real good integration system. So being not Silke, I was, of course, fighting in front of every single war I've got. And I was fighting with the mayor and with the governmental systems that he was able to go to a normal school. And I won, of course. We never had problems, and you see him in a birthday party with his friend. We never had problems with peer groups. We never had problems with his friends or with other groups. He was always accepted and integrated. The problems were mainly the adults, the systems, who not accepted him. He had a stamp on his brain and in his head, and this was named, he was a preemie. And also when he was at the high school, so Lucas was very good, and the intelligent test gave us right that he was able to go to the high school. He made his A-level, but also only because we had to fight in front, again, governmental institutions to bring him to, in the end, university. We won. We were, and we are still fighters. But I want to share with you this, that our journey ends not in the NICU. Our journey really goes lifelong. And I ask myself often, is Lucas really a preemie forever? And what are the challenges for the whole family? And what is really a challenge is that we as a couple focused all the years only on Lucas, and we lost often our own partnership only because we had their own focus was Lucas. And that is something where many, many couples struggle when they had a preterm birth and have a preemie, to cope with the situation, and not to forget that there would be another child. And every birthday, every Christmas, the first day when he went to school was a hard day. It was not always a happy day, mainly not because I cried all the time that there would be another child starting school. And so for me, it's a challenge to let him go, to let him develop as a young adult. And you see here a picture where we were in Iceland, and I'm still a helicopter mom and taking care of Lucas. I guess too much, but he is my little prince, and still is, and that's challenging for us to cope with the situation also after 22 years. Lucas is smaller than other children or young adults in his age, and he is more shy. He has many of these outcome results, what you can read in studies. He for sure has a happy life, but we still struggle sometimes. He's not able to bike. He had or needed more time to make his driving license. We had still struggle at school, at kindergarten, and the systems made us a lot of problems. And still we don't know what happens later in life. Here you see Lucas on his 18th birthday, and this is very special for our life, is that we not know what happens. So you see the waves going up and down, and we don't know what the future will bring. So when you think tomorrow on, you go back in your hospital and you see these little tiny babies in your incubators, and you maybe think about, should we have a camera system, or should we have this or that, or should we allow the parents to be there 24/7? Think twice, because these children will go home after NICU. They need their parents. They need a good relationship. They need a good development. And this really matters, what you're doing every day. And, of course, I'm very grateful what my NICU team has done for us and for Lucas and for our family. But it was a challenge at this time, and I hope that in the future there is no question any longer to welcome parents 24/7 if they come in person or they come digital, or if they attend a NICU visit or whatever, so that parents really can be parents and the babies can be the babies of their parents. Thank you very much.